Hello, welcome everybody. Thank you for joining the question and answer session today. And I'm joined by an experienced panel of a therapist and also a senior nurse. My name is Kiruba Nagaratnam. I'm a stroke consultant and also a geriatrician. I've been a stroke consultant for nearly 7 years. And I'm joined by Shivanti Panchalingam. She is an experienced stroke nurse. Hello, Shiv. And she has approximately 20 years of experience looking after and managing stroke patients and also managing the stroke service at the Royal Berkshire Hospital. And also we are joined by Pooja Pau. Pooja is our occupational therapist. She has nearly 17 years of experience looking after stroke patients. And we are going to answer your questions over the next hour. Please do feel free to post your question and we'll try to answer them as they come along. So while we are waiting, I can already see there is a question has appeared. And the question is having a stroke painful? So compared to heart attacks, everybody knows when people have heart attacks, they get severe chest pains, and that's how people know someone is having a heart attack. But most of the time, I would say in 99% of the time even, the strokes do not come with pain. Very occasionally, if the strokes are caused by damage to a blood vessel in the neck, that can sometimes be preceded by severe headache or pain behind the eye or pain in the back of the neck. That can sometimes cause pain. Or if people have bleeding in the brain, which we call it primary intracerebral hemorrhage, that can sometimes cause severe headache. But otherwise, most of the times, strokes do not cause any pain. But stroke causes a different set of symptoms, that is face weakness, arm weakness, or leg weakness. When you or somebody that you know suddenly unable to speak, unable to move one side of the face or arm or leg, that's when it is time to alert the ambulance. And these are the most common symptoms, but occasionally people can also have other symptoms such as spinning sensation, double vision, loss of balance, slurring of the speech. These are also signs of strokes, and you need to be aware of it because everybody remembers the FAST acronym. So that's face, arm, speech, then time to call, but we also need to be aware of other symptoms that might indicate a stroke. And when the important message that we want to get across is if you think you have stroke symptoms or someone else that you know has stroke symptoms, do not wait, call the ambulance. And the number to call is 999, it's not 111. And so there's another question that appeared on our screen. How long does it take to recover from a stroke normally? I think I'm going to pass this question to Pooja first, and Pooja is our occupational therapist. She is going to talk about the stroke recovery. Thank you, Pooja.
Hi, hello. Stroke recovery really depends on the lesion of the stroke and how large the stroke is. So it varies from individual person to person. What I would say is the most important thing is the rehabilitation, especially in the acute phase, the first 3 months following a stroke, which can really impact the recovery of how that person will be, the functional outcome. So I think it is really important, as Kiruba said, is where you alert for help by calling 999, and most likely, if it is confirmed stroke, you'll be admitted to the acute stroke unit where your rehabilitation process will commence. And it can vary for some people. So if it's not a large stroke, some people make a full recovery within a week or two, whereas some people take 3 months to 9 months to recover. So it really depends on the lesion of the stroke and the impairments and how much that stroke has impacted that person. So if I just talk a little bit about some of the impairments a stroke can cause, which Kiruba did touch upon, but a lot of people do get weakness of one side. So it could be arm weakness along with lower limb weakness. And that's where physiotherapy and occupational therapy is paramount to strengthen those muscles. Another impairment would be vision. And it's very important that that person gets the appropriate rehab for that vision. As well as speech. Speech can be impacted as well. Thank you. Back to you, Kiruba.
Thank you. Thank you very much for that very detailed explanation for that question. So I can see another question. It's from Gurudat Manava. The question is it's a two-part question, so I think it's better if we share the question between me and Shiv. The first part of the question is, do you see a lot of young patients coming with stroke? And the second part of the question is, and also does family history play a major role? So Shiv, would you like to answer the first part of the question? Do you see a lot of young patients coming with stroke? Thank you.
Thanks, Kiruba. I think for us, our age group over the last few years has definitely got a lot of younger patients coming through than we would normally see. I know when I first started out in stroke, our age group was a lot older. But over, as I said, the last few years, we've definitely seen a lot younger patients coming through. Our youngest patient to date that we've had on the unit was 18 years old. So it's definitely changed from when I first started out in stroke nearly 20 years ago.
Thank you, Shiv. And that's right, Shiv is right. And also in medical literature, there is very good evidence over the last few years. The number of stroke patients with the age between 45 and 55 has been steadily increasing. The exact reason for that is not completely clear, but we do have an idea because lack of exercise, obesity, increasing prevalence of high blood pressure, diabetes. We believe these could be the reason for the increase risk of stroke in this younger age group. We will touch upon preventing strokes later on. I'm sure there might be questions related to that as well. And the second issue is, question is, does family history play a major role? The question is very interestingly worded, actually. Does it play a major role? I would probably say, except in certain type of strokes, in medical terminology, we call it monogenic strokes. That means these are very strongly genetically linked type of strokes, and these type of strokes are only very small proportion of the strokes that we see. But majority of the strokes that we do see are not directly linked genetically, but certainly a family history of strokes do play a role in increasing the risk of strokes. That's mainly because all the risk factors that causes stroke, the most common one is hypertension, high blood pressure, high blood sugar, high cholesterol. These risk factors tend to run in families. And if you're a close relative, that we call it first degree relative, that's either your parents or your siblings, if they've had any of these conditions, then you are more likely to have high blood pressure or high blood sugar. That would in turn lead to increasing the risk of strokes. That's when you need to be extremely careful that if someone in your family was diagnosed with the hypertension at a younger age, it is absolutely important for you to go and get yourself checked to make sure that you don't have hypertension or high blood sugar or cholesterol. And people who live in the UK, you know that over the age of 45, most of the GP surgeries will invite you for NHS health check. The idea is to identify these risk factors early on so that we can prevent strokes and heart attacks later on in your life. We always say, 80% of the strokes are preventable. We can do something to stop those strokes coming later on in the life. So the next question is, what is a mini stroke and how is it different to a normal stroke? So mini stroke, it's normally called a transient ischemic attack. So if you translate that into kind of plain English, that is, transient means that something comes and goes fleetingly. Ischemic attack, that means the blood supply to the brain was interrupted for a fraction of a second. So when somebody has their blood supply to a part of the brain interrupted for a very short period of time, they will have symptoms as a result of that. And these symptoms only last for, I would say, ideally 15 to 30 minutes, although the definition might say it can last up to 24 hours, but ideally these symptoms only last for 15 to 30 minutes. Majority of them will disappear within an hour. So this is called a mini stroke. You will have typical stroke symptoms, but they will all disappear within an hour, ideally. And this condition is very important. People sometimes tend to ignore them and leave them and say, oh, I've had something, I couldn't suddenly move my hand, and this disappeared after about 15 minutes. It might be something, I don't need to pay any attention to that. That is not correct. If you've had those symptoms, you must seek medical advice, because this could be a harbinger of a major stroke that might happen in the next few weeks to a month. So that is important to take these symptoms seriously and seek medical advice. So I'm looking at other questions. How has treatment for strokes changed? Shiv, would you like to answer that question? Because you've been in the stroke field for nearly 20 years, so you can just shed some light on that. Thank you.
Thank you, Kiruba. I think the main difference for me from when I first started is that stroke patients coming in to hospital within 4.5 hours of having their symptoms, if they do meet our criteria, we can actually offer them clot busting treatment these days, something that's quite a relatively new treatment. And following the clot busting treatment, again, if appropriate, we can look at what we call a thrombectomy, which is removing that clot. Obviously, that does involve travel to another hospital from ours, unfortunately. Again, which is why, as Kiruba's recently said, it's so imperative that patients with any form of stroke symptoms comes into us and comes in quickly so we can actually treat them these days. And obviously, with thrombolysis and the thrombectomy services that are run here, that does offer our stroke patients a really good form of a very good recovery following their stroke.
Thank you, Shiv. And apologies, some posts coming through saying that the connection's breaking up, and also they have difficulty picking up the feed on Facebook. Please do report us if you continue to have these problems, and I'm sure we will. You will be able to access the recording of this question and answer session. And apologies for the interruption. And another question appeared here. It's the question is mainly related to the risk of strokes associated with COVID vaccinations, and particularly AstraZeneca vaccine was there were reports of association between the vaccination and thrombosis, and most of the reports suggest that this thrombosis normally happens in the veins, in the legs, in the lungs, or in the brain. So we call it venous sinus thrombosis. And lots of people have been vaccinated in our region since January, but in our practice, personally, we haven't had anybody with thrombosis complications as a result of vaccines. Certainly, strokes is slightly different from that. Actually, stroke is caused by blockage of blood vessel in the brain, There are a few reports, some of my colleagues have reported in one of our websites, but we haven't seen any ischemic strokes associated with vaccines or venous sinus thrombosis, which is thrombosis of vein in the brain associated with vaccines either. And okay, so while we are waiting for further questions, so we could talk about a few things. Then about the stroke treatment that Shiv has touched upon, and Shiv talked about intravenous thrombolysis, and we can talk about mechanical thrombectomy very briefly. And also we shouldn't forget there are two types of strokes. One is ischemic stroke, which is the most common type of stroke, and nearly 80 to 85% of the patients do have this type of stroke. The other one, most of the people call it a hemorrhagic stroke or primary intracerebral hemorrhage. This means one of the blood vessels in the brain leaked and it caused bleeding in the brain, which is 15% of the strokes, 10 to 15% of the strokes are of this kind. Okay, so while I'm talking about that, there is another question that appeared there from Leah McCarthy. This is, what are the benefits of being admitted to a stroke unit? Very interesting question, because stroke unit really makes a difference in the care of stroke patients. So I'm going to pass this question on to Shiv, first to you, and also to Pooja, to explain how we make a great difference to our stroke patients when they come to stroke unit. Floor is yours.
Thank you, Kiruba, and I'm sure that Pooja will be backing me up on this one. So I think the difference with a stroke unit in particular and patients being admitted onto a stroke unit very quickly is obviously very early access to the multidisciplinary team. We work very closely on here, basically trying to support the patient in their rehab pathway. And we couldn't do that without all of our therapists and our medical and nursing team together. Early access to a stroke unit gives us early access to a physiotherapist for positioning purposes and reduces the chance of contracture of your limbs. We have early access to the occupational therapists, obviously, who can pick up a lot of problems that may very well be masked on a unit that isn't specialist in knowing what they're actually looking for. We have our speech therapists as well for early assessments of the patient's swallowing, and making sure that access to early nutrition, which is really important for that patient's rehab. And obviously the medical and nursing team as well, from knowing how to care for those patients, recognizing the signs of patients deteriorating or needing things, particularly when they've got speech issues. And our nurses are highly trained in recognizing patient needs as well. But I'm sure that Pooja can add a little bit more on the therapy front and the importance of coming to a stroke unit very quickly.
Hello, Pooja. Would you like to join us to expand on that, please?
Thank you, Shiv. Thank you so much. Just to extend on what Shiv has said, I echo a lot of Shiv's comments, but one thing I would like to say is being admitted to a stroke unit will afford you the opportunity to be treated by specialist therapists who have lots of expertise in stroke rehabilitation. So as Shiv has touched upon, is that comprises of a team of physiotherapists, occupational therapists, dietitians, psychologists, and speech and language therapists. And they work very much in a multidisciplinary way to maximize, the patient's rehabilitation. So one of the things that we work towards is ensuring that every patient gets 45 minutes of therapy per day. And research and outcomes have shown is patients admitted to a specialist stroke unit go on to make better gains and improve their functional outcomes. Another thing is we have access to specialist equipment and the latest technology. So if I talk a little bit about the functional electrical stimulation, the BINS, which is something we have on the stroke unit that we use with patients who have got limb weakness or hemiplegia to improve movement in the arm. Another access will be the gym. We have a specialist gym where a lot of our patients are treated as part of their physiotherapy, which is great because that's very much needed. And it's really important to note that the most recovery takes place in the first 3 months of a stroke. So it's crucial that these patients are having access to specialist rehab in line with the government guidelines. Thank you.
Thank you, Pooja. That was excellent. And I have another question that appeared on the screen. If I have already had a stroke, does this put me at increased risk of having another in the future? So I will answer to that question. So if somebody has already had a stroke, unfortunately, that does increase the risk of subsequent strokes. And that's when both the doctors and you as the patient should work together to prevent further strokes. So I'm just going to take a bit of time to explain that. What are we going to do? What can we do as medical profession to prevent further strokes, and what can you as a patient do to prevent further strokes? So when someone comes in, if they say that if they've had an ischemic stroke, we will do necessary investigations to identify the source of the clot, where it might have come from. The most common source of the clot is a narrowing of the blood vessel in the neck. So we would look at the blood vessels in the neck very carefully and see if there is any evidence of occlusion. If that's the case, then the patient will be referred to have an operation to remove the blockage to prevent further strokes. And the clots can also come from the heart. For example, if you have a condition called atrial fibrillation, this is an abnormal heart rhythm that does increase the risk of strokes. And it's really important that, I always ask people to learn to check their pulse, because it is very easy thing to do. For example, I can demonstrate it. So if you look at my hand here, and all you have to do is you have to look at the thumb side, and then you put your fingers up there just above your wrist, and then you should be able to feel your radial pulse. So this is a really useful way. And if you think your pulse is irregular, and you also can have these apps on the phones, they can help to test your pulse and see if the pulse is irregular. If it is irregular, speak to your GP, because this abnormal heart rhythm can increase the risk of strokes. We also test your blood to make sure that you don't have high cholesterol or evidence of diabetes. So these are some of the tests that we undertake to identify if you have any risk factors to increase further risk of strokes. And we start people on medications. If you have high blood pressure, we will start you on blood pressure medications to reduce the blood pressure. Cholesterol medications, mainly statins, to reduce the level of cholesterol. If there is evidence of diabetes, then we would start you on anti-diabetic medications. Most importantly, if it is an ischemic stroke, strokes are caused by clots, we will start you on a blood thinning medicine to try and prevent further strokes. And what can you do to prevent strokes? Because that is as important as what we do. And certain things are really important. First of all, when you are on a blood pressure medication, you need to take the ownership of that. How can you do that? We always encourage people to monitor their blood pressure at home. It is not easily available. Blood pressure monitors can be bought over the counter. And keep an eye on your blood pressure. Make sure your blood pressure stays below the value of 140 or 90 millimeters mercury. It can be slightly tighter control for certain conditions, but normally if you try to maintain it below 140 or 90 millimeters mercury, this gives you a reasonable protection. And if you're a diabetic person, make sure you look after your diet and keep an eye on your blood sugars. Make sure you exercise regularly. And it doesn't mean that you need to go to a gym or take strenuous exercises. But if you take a brisk walk, at least for 30 to 40 minutes every other day in a week, that would be sufficient for most of the people. So that's an important secondary prevention measures that you can take. So by working together, we can reduce the risk of those strokes. And moving on to the next question. So what are some of the easy things that anyone can do? So I have already suggested some of those things. Look after yourself. Make sure exercise regularly, watch your diet. If you're a smoker, please stop quitting smoking from today when you come off this Q&A session. Because I always say, stopping smoking, it's never too late to stop smoking. And when you stop smoking, your risk of heart attacks and strokes do come down. There is never too late to stop smoking. You can stop at any age, at any time. There are other things, this is not easy. I'm not saying that stopping smoking is an easy thing to do, but there's help available. If you're a smoker, think about it. So the next question is, how do you get alerted to a patient being in hospital that has suffered from a stroke? So Shiv, would you like to take that question, please? How do you get a patient being in hospital that has suffered from a stroke?
Thank you. So for us, obviously, it is the recognition that a patient's actually having a stroke that's really important for anyone that's actually working in the hospital. That could be from one of our domestic supervisors or even from a nurse to a consultant. It's that actual initial recognition that somebody's had a stroke. We're here 24 hours a day, 7 days a week. All you need to do if you think your patient's having a stroke is to dial 2222 and ask them to put out a stroke thrombolysis call, and we will come and assess the patient as soon as we get that bleep. For us, even if the patient isn't having had a stroke, or is just unwell, we would rather have been alerted and come and seen that patient than find possibly the patient has had a stroke and we didn't know about it, we couldn't offer any help. But I think the important thing is, as I said, is just to let us know. Pick up that phone and dial the emergency number to get us to come to the ward.
Thank you very much, Shiv. The next question is a very important question, and this is about post-stroke fatigue. Could you give some advice on coping with post-stroke fatigue, please? So it's nearly 80% of the people do suffer from post-stroke fatigue, and it is under-recognized but has a significant impact on people's quality of life. So the best qualified person to answer this question is Pooja. So I'm going to give the floor to you, Pooja. Thank you.
Thank you, Kiruba. So as Kiruba said, fatigue is very common post a stroke. 80% of patients report fatigue, and it's not just physical fatigue. Stroke can sort of affect the way you think and you process information, so it can be mental fatigue. It varies from patient to patient, so it can vary from being mild to severe. And just some of the tips. So an occupational therapist and a psychologist are probably the best placed to really put a fatigue management program in place for yourself. So that would be putting a diary in place to identify the triggers which make you tired. So we would balance. So where you have activity, that would follow by rest. Some of the strategies that we advise is planning. So planning your day ahead and prioritizing your tasks. So anything which is not a priority that can wait or can be delegated to sort of conserve your energy and pacing. So a lot of our work will be looking at the way activities are done and adapting that activity. So this is where equipment can be very helpful. So a lot of our patients are discharged home with something called a perching. It will still enable them to do the activities, but in a different postural set. So they're sitting as opposed to standing, which would conserve more energy. We would look at aids. So things that we recommend is an electric toothbrush as opposed to a manual toothbrush to take away the extra energy that is required to clean your teeth. What I would recommend, just answering the question, is Stroke Association has got some fantastic websites and some great literature which people could go onto and look, and it's available to all and it's free of charge. Thank you.
Thank you. Thank you, Pooja. Okay, so we're waiting for more questions to come up. During that time, Shiv, would you like to talk about any important issues or concerns or a message that you would like to share with our audience? Anything from your experience of looking after stroke patients over the last 20 years? You know, it's really important to share that with our audience. Thank you.
I think for me, in all seriousness, we obviously look after stroke patients every single day of our life. If we can only get one message out there today, it's the message that if you think you are having a stroke, regardless of how minor it is, will you please ring 999 and come into hospital? It's the one thing that you can do that can make a difference to your outcome. And regardless of all the expertise on the stroke unit, it's the initial picking up that phone. Please don't wait. Please don't go to a GP surgery. Just dial 999 and come in. The quicker we see you, the quicker we can make a difference to your life. And for me, you know, having seen patients over the last 20 years and seeing the advancements in technology and as I said, all the expertise on the stroke unit, the best thing that anyone can do is to get in so that we can actually treat you as quickly as possible. You're certainly not wasting any of our time. You're certainly never going to be dismissed by any of us for coming in. And if it's not a stroke, then that's a bonus. But we've seen you, we've assessed you, and we've made sure that you're safe to get home. And that's the biggest message that I can put out there today, is just come into hospital so that we can actually treat you.
Thank you, Shiv, and absolutely right. That's the most, you know, this May is the Stroke Awareness Month. The Public Health England has declared May as Stroke Awareness Month. And if one message that we want to get across is, if you think you are having a stroke, or someone that you know having a stroke, do not wait. Because if the stroke is due to a blockage of a large blood vessel, and every minute we delay the treatment, nearly 2 million neurons die. So and it's going to have an impact on the outcome. But we are here 24/7, and we are ready to receive you, do necessary investigations, and look after you. And so the question is, there's another question that's just has come up. It's about the stroke symptoms. We touched upon in the beginning of our Q&A session. So stroke symptoms, and we all know about the most common stroke symptoms. That's the FAST acronym. So that is face, arm, speech. So if someone notice that someone's face is falling on one side, and if they have difficulty speaking, that means expressing themselves, or if they can't use their arm, it doesn't have to be the whole arm, it could be just the hand. If they're dropping things suddenly for no reason from their hand, and that might be a sign of a stroke. Or if they have difficulty walking, that means leg weakness. So it is really important that, because, you know, I've met people telling me that they did not alert the ambulance because they did not have all three symptoms in one go. Because not everybody gets face, arm, and leg weakness and speech problem. Some people might just have speech problem, or might just have a hand weakness or arm weakness. It could be still an early sign of a stroke, and there's no reason to wait. as Shiv has just mentioned correctly, that if you come to hospital and if it turned out to be not a stroke, that's good news for you, but at least you've had the right test and seen the right people to make that right decision, and that's safe. And the other important information is that and message that we want to get across is that sometimes some people do have slightly different set of symptoms. Started suddenly seeing double vision, or losing the balance, and sometimes just slurring of the speech. These also can be signs of stroke, including sudden sensation of spinning. So if these symptoms come on without any warning suddenly, then you need to be aware that these might be signs of strokes. So you need to seek medical help immediately. So another question there, can a shock or trauma bring on a stroke? Interesting. So comes to trauma, yes, it can. It depends what type of a trauma it is. The question is if it's a physical trauma or mental trauma. Physical trauma can sometimes bring on strokes, because we did talk about the blood vessels that are supplying the brain actually go through the neck. So sometimes the trauma can induce damage to the blood vessels in the neck. We call it dissection. And clots can come from that and then can cause strokes. And mental trauma about stress, there is a link between stress and a stroke. And the link is not as clear as with other associations, such as the link between high blood pressure and stroke, or diabetes and stroke is much more clearer, much more stronger than the link between stress and a stroke. But there is certainly a link, because stress can cause a range of changes in our body. It does increase the blood pressure. It does increase the level of stress hormones, the chemical substances in our body that can make you prone to have strokes, because those hormones can make your blood sticky, so that you are more likely to have a thrombus. So there are various possible complex reactions can be brought on by stress that can lead to strokes. So it's always advisable, or it's always easier said than done, to try and reduce the stress levels. It can actually help to reduce the risk of strokes. The next question is, are there any early warning signs that I might mean I have a stroke in the future? So the one thing that I could suggest there, so the question is about, is there anything that I might have that tells me that I'm going to have stroke in the next few days or not? We touched upon that earlier again. It's the mini stroke. So mini stroke, or in otherwise it's called transient ischemic attack, where people get typical stroke-like symptoms, but the difference between those symptoms and the mini stroke symptoms is that stroke symptoms appear suddenly without any warning. People suddenly lose things, speech, arm movement, limb movements, and they last for more than a day or two. Sometimes they can last for much longer period. So that's a permanent impairment or damage caused by lack of blood supply or bleeding into the brain. So that is stroke. Mini stroke is exactly the similar symptoms, but they do not last as long. They normally disappear or fully recover within an hour. So this is a mini stroke. So that's a harbinger of another stroke that's coming on the way. The people who have had mini strokes have much higher risk of having a major stroke within the next 30 days. Therefore, if somebody had a mini stroke, it is important they alert if the symptoms have fully resolved. If you have symptoms, call the ambulance. By the time ambulance arrives, if your symptoms have fully resolved, and they will make the decision whether they need to take you to the hospital or refer you to a mini stroke clinic. But you need to call for the help at that point. What can I do to support someone I live with who has had a stroke? Okay, so I'm going to ask Shiv and Pooja to answer this question. So, okay, right. Oh, both of you appear at the same time. Would you mind, Shiv, if I go to Pooja first and then after you? That'd be all right. Yeah. Great. Pooja, would you like to take this first, the question first? How can we support someone who've had stroke?
Thank you, Kiruba. I think there's a lot somebody can do to support someone who's had a stroke that they live with. First and foremost, I think it's really important that you ensure they're taking the medication that's been advised by the nurse, which I'm sure Shiv will touch upon in a little while, but also support them with the exercise program recommended by their treating therapists, so the ward therapists. I think that's really important to ensure that they're doing those exercises to continue to make gains with their rehab. You know, I didn't mention earlier, but a lot of stroke patients are discharged with rehab services. There is a service called the Early Supported Discharge Team. So if you have any community services coming in to support your family member, it's working with them to ensure what you can do to help your family member do those exercises if they are not able. And another real key thing is just to monitor the symptoms. So if you find that that those symptoms are getting weaker or there's a change in some of those symptoms, it's just alerting the GP to sort of raise any concerns that you have. And it's also just being aware of their symptoms. So before your family member is discharged, the multidisciplinary team are normally very helpful. So it's sort of spending some time with them, talking to them to find out what the impairments are and what you can do to support them. And it's having that knowledge that they may not be the person they were prior to the stroke. And that's where you will need to be that little bit more patient with them. Over to you, Shiv.
Thank you, Pooja. I think for me, it's if you are a carer or a relative of someone that has had a stroke, I think it's just being aware that when patients get home, you might just need to take a bit more time with them. Obviously, we've already touched on post-stroke, post-fatigue following a stroke. And I think a lot of that is the patient that comes home may not be the same patient that went into hospital. A lot of patients can suffer emotional problems following a stroke. They can get exceptionally tired. Things that they used to manage very well and very quickly, they may need to take their time with that. And I think recognizing that as a carer or someone looking after a patient that's had a stroke is really important. There is a lot of frustration as well. Again, as I said, patients that have come home that may be able to have mown the lawn really easily or done the hoovering or any of the household jobs may actually take a lot longer to do that. And I think it's really important that we recognise those patients need a little bit more time sometimes to do jobs that were very simple for them. Again, we may have, as I said, some personality changes. And the patient themselves may be feeling really frustrated at not being able to do that, the jobs that they could do before. I think it's really important to know that there is a lot of support out there. The Stroke Association runs a really good stroke recovery programme, and that is in our local areas. Obviously, that has been disrupted somewhat because of COVID, but they are still out there and they are supporting patients that we have discharged home. But also, they do run a lot of clubs and give support that way, give carers a break. But also, they know exactly how to actually look after patients that have had a stroke and how to give the carers and relatives support, which is really important to recognise that this is going to put a lot of pressure on yourself as well. And I think taking the time for yourself and having a break is really important.
That's great. Thank you, Shiv. Thank you. So there's a couple of other questions about the stroke symptoms. Do stroke symptoms differ for men and women? No, they don't. Regardless of your sex, the stroke symptoms are exactly the same. So, and if you have those symptoms, please do seek help. And the second question that we've already discussed about a range of symptoms that people can have as a result of the stroke. The next question is, what happens when I arrive at the emergency department with the stroke? So I'm going to, Shiv, would you like to start with that, and then I will follow on? That'd be okay? Great,
Yeah, sure. So obviously when you come in as a patient to ED, most of the time we've been pre-alerted by the ambulance crews, so you will be greeted by our smiling faces. We will take you through very quickly, usually into the resus department. Obviously that can change depending on capacity issues and what's happening in the emergency department at the time. You'll be assessed very quickly by one of our stroke nurses. Also our stroke consultants or neurology consultants will be there as well. And we'll do some assessments very quickly. The nurse will be taking your blood pressure, potentially putting in what we call a cannula, so a line into your hand. And we'll also be trying to arrange to get you through for a scan. Usually we can do all of that within 5 or 10 minutes of you arriving, and you'll be going off to have your scan really quickly from there. Obviously, as Kiruba said at the beginning, time is brain. So the quicker we can actually get you through, get you assessed, and get you to a scanner quickly to see what's happening will depend on whether or not we can give you the clot busting treatment. And I think obviously Kiruba can touch on a little bit more about the clot busting.
Thank you, Shiv. So I'm just going to talk a little bit about the acute stroke treatments. It's a very good opportunity to just talk a little bit about and the benefits of those treatments as well. So early on in the Q&A session that we discussed about two main types of strokes. The most common type is ischemic stroke caused by blockage of blood vessels, and the part of the brain that receives blood supply through that blood vessels will be damaged as a result of it, and this type of stroke is called ischemic stroke. The other type is called primary intracerebral hemorrhage, which is actually bleeding into the brain as a result of a damage to a small blood vessel in the brain. People always do kind of confuse between the aneurysmal bleed and this the stroke type of bleed. The aneurysmal bleed is slightly different type of bleed. We call it subarachnoid bleed. This is caused by a rupture of an aneurysm, which is an abnormal outpouching from a normal blood vessel. That is a different type of bleeding, and it is managed completely differently. So if we talk about the ischemic stroke, the most common type of stroke that is caused by blocked blood vessels, Shiv has touched upon the intravenous thrombolysis. This means that we injected medicine through the veins to disperse that clot and re-establish the blood supply. If you arrive at the emergency department within 4.5 hours of symptom onset, then you can receive this treatment. Why can't you receive it beyond that point? Because beyond that point, if we give this treatment, the benefit start to decline. At the same time, the side effects of the treatment increases. Because you see, the brain is one of the organs in our body that needs lots of oxygen to function. So if you block the blood supply for a short period of time, even after 5 minutes, the brain cells started to die. So if we leave it till 4.5 hours, then most of the blood cell, brain cells within that region would have been dead by that point. Reopening the blood supply to that part of the brain will not provide any benefit. So that's the reason that that treatment is given within 4.5 hours. Even though we have 4.5 hours to give that treatment, we would like to provide that treatment as early as possible. So the earlier the treatment, the better the outcome. That's why it is important. Time is brain. So it's really important to receive the treatment early. Then you can see that if the clot is small, then the chances of that being dispersed by the intravenous medicine alone is much higher compared to a bigger blood clot. Sometimes people do have large blood clots blocking a very big blood vessel in the brain, causing a serious damage. In that case, thrombolysis treatment alone won't work. That treatment is weak to disperse the not strong enough to disperse the clot. In this particular scenario, patients can have mechanical thrombectomy. This means that we are at the Royal Berkshire Hospital. We do not offer this treatment, but we do transfer our patients to the nearest neuroscience centers. But if you live near to a neuroscience center, which is a big tertiary hospital, for us it's Oxford, and there are several hospitals in London. If you are admitted to those hospitals, then you will receive that treatment in the same hospital. But in the UK, most of the hospitals do have the facility to either do this treatment or transfer the patients to an appropriate hospitals to receive this treatment. This is called mechanical thrombectomy. So what happens? So if there is a large blood vessel is blocked by a big clot, the interventional neuroradiologist, under the guidance of an X-ray, insert a wire through the groin and move that wire all the way into the brain and pull the clot out and re-establish the blood supply. For a serious, severe type of stroke, this is the most effective and efficient treatment. And every 3 patients we treat with this treatment, 1 person will be less disabled. There are very few treatments in medicine, in the field of medicine, that has a benefit with this magnitude. So it's a really, really successful and very efficient treatment. But people again need to be in hospital within that time window. Mechanical thrombectomy can be provided up to 6 hours, but earlier we give this treatment, the better the outcome. And the other type of stroke is bleeding into the brain. So there are no specific treatments that are available to stop bleeding in the brain. But if you are, say, taking a blood thinning medicine, then we can give medications early on to reverse the action of the blood thinning medicines to stop the bleeding in the brain. And also we can observe the patients closely and try and bring the blood pressure down to try and stop the bleeding getting bigger. So again, as you might have noticed, all the stroke treatment, regardless of the cause, is it ischemic stroke or a bleeding, the time is of an absolute essence. So that's why it is important, and we also ask people to come to hospital as early as possible. That is very important. And what are the side effects of the treatment? Thank you for that question. So the side effect, the thrombolysis treatment, the aim of the treatment is to disperse the clot. So the side effect is because it thins the blood and it increases the risk of bleeding. But in experienced centers, the risk of bleeding is very small. So we see for every 100 patients we treat, 6 or 7 patients may have some bleeding, either in the brain or elsewhere in the body, but this bleeding is non-life-threatening. But 1 person will have a serious bleed. So every 100 people we treat, 1 person might have a serious bleed. But 30 people are more likely to be independent as a result of the treatment. So if you look at the benefit, which is much higher than the risk. So that's the most common type of side effect. Most common side effect is as a result of this treatment. And the other common side effect is that you can have allergic reaction. That also happens in 1 or 2% of the people, so that is not high either. So these are the 2 common side effects that happens as a result of the thrombolysis treatment. And Shiv, if you would like to add anything to the treatment or side effects, please welcome. Okay, so we are coming to the end of our Q&A session. Hope we have tried our best to answer all of your questions, and then you also had an opportunity to answer the questions. And we are sorry that there are some difficulty with the streaming on the Facebook platform, but the recording of this Q&A session will be available for you to watch later on. So again, our important message is, if you think that you have symptoms of stroke, if you think that someone you know has symptoms of stroke, please do not wait. Call 999, come to hospital, and we will review and provide treatment early, because time is brain. Every minute we delay the treatment, people lose brain cells. So please do come early, and we can give you the right treatment as soon as possible. And that's the most important message. Look after yourself, take regular exercise. And if you have any risk factors, high blood pressure, high blood sugar, high cholesterol, make sure you check them regularly. Make sure you take your medications regularly. Monitor your blood pressure, check your pulse. And if you think your blood pressure remains high or your blood sugar is not being controlled, talk to your GP and make sure these risk factors are appropriately controlled. And this will reduce the risk of strokes. And thank you very much. And thank you, Shiv, for your excellent contribution. And thank you, Pooja, for providing the answers on the background of your extensive knowledge in looking after stroke patients and providing occupational therapy. And hope you enjoyed the Q&A session and found it useful. And thank you for your time. And thank you, Pooja. Thank you, Shiv.